Hi, my name is Dr. Rosie, and I am a physical therapist here at Physical Therapy and Balance Centers of Oklahoma City. And I would like to talk to you today about benign paroxysmal positional vertigo, or BPPV. BPPV is one of the most common causes of vertigo. Vertigo is a specific type of dizziness in which a patient perceives a false sensation of movement, whether that be spinning, rocking, or swaying. BPPV is characterized by transient or short-lived episodes of vertigo that are consistently brought on with a change in position. The most common positional changes that induce vertigo in a patient suffering from BPPV are rolling in bed, going from sitting up to lying down, bending over, or leaning back. And what causes this vertigo, you may ask? Well, let me show you. In our inner ears is a system of 6 organs called the vestibular system. It is so small. Altogether, it's about the size of a dime, and they sit almost behind our eyes. The 4 organs involved in BPPV are the utricle, which is a sac-like structure, and 3 semicircular canals. In the utricle, on the base, is a patch of hair, and on that hair sits gel. And on that gel are hundreds of thousands of itty-bitty ear stones called otoliths. You may have heard them called crystals. Now, when we move in horizontal linear acceleration, like when you move in a car and you stop and you know you've stopped, it's because those little stones are responding to gravity. They pull on that gel and that hair to tell our body where we're at in horizontal linear acceleration. The other 3 organs, the semicircular canals, are filled with fluid, and at the base of each canal is their own patch of hair, and around that hair is its own patch of gel, but this time, no stones. Now, when those semicircular canals are functioning how they should, when we move our head, whether up, down, turning, tilting side to side, that fluid moves, and it acts on that hair like a sail in the wind to tell our brain where our head is at in position. What happens with BPPV is that some of the stones in the utricle become dislodged, whether that be from a fall or from a prolonged dental procedure, or they just become dislodged sometimes. Now, sometimes when they are free floating in that canal after they've been dislodged, they will enter a semicircular canal. And if they do, they cause that fluid to move abnormally, and it sends false information to the brain about the position of our head. Meanwhile, the brain is perceiving correct information from the other ear as well as our eyes. So while the brain is trying to figure out what is going on, the patient experiences vertigo. Here at Physical Therapy and Balance Centers of Oklahoma City, our therapists are trained to correctly and successfully identify and treat BPPV. We do this by bringing our patients through a series of tests to find out which ear and specifically which canal has stones in it, and then taking the patient through a safe repositional maneuver to get those stones back into the utricle they came from. If you or someone you know is experiencing vertigo, we would love to come alongside them and get this treated here at Physical Therapy and Balance Centers of Oklahoma City.